Welcome. How can I help you? What brings you here to the office? You guys are, this is mom?
Yes.
Mom's coming from pretty far away.
Yeah.
Why did you bring mom out here?
Back pain that's getting worse.
Okay.
And it started like since 97.
Okay, so you're saying back pain since 1997. It
Yes.
was 2019.
I know.
You had a fall
Yes.
before 1997, right?
Right.
Okay. What happened? Tell me about the fall. That's important.
Hit and fall down.
What hit?
Her.
Who hit her?
Well, prior.
Okay. So she got hit. She
Yeah.
was in a fight.
Yes.
Let's just say she was
Yeah.
in a fight. She
Yeah.
got hit.
Yeah.
And she fell down.
Yes.
She fell down on the floor, down a flight of
On the
stairs.
floor, yeah, just on the floor, she was weighed like 90 kilograms.
Okay, she landed on her back,
Right. Yeah, because people that.
right?
Yeah.
She landed on her butt.
Yeah, on her back.
Okay, that makes more sense now. Okay. And that was back in the 90s.
Yes.
Okay, then
We were
what
little.
did she do for it?
Nothing, just
Deal with it.
Yeah, deal with it. Yeah.
Okay. All right, so let's fast forward. Then what happened?
Do pasta something. And then she was like this. Something about pasta. Yeah, she just started to working and it involved some heavy lifting
Okay.
because selling in marketplace and just carrying all this stuff
Okay.
and not too much support, and that's why she was kind of must do it.
So over the years, she's been doing lifting.
Yes. Yeah, like
working
every
at that-
day. Yeah.
Whatever, every day she's lifting.
Yeah.
Okay, and this goes back to an old injury from the 90s where she had a bad fall.
Yes.
Okay. Now, from that fall, there was no treatment. She just kind of dealt with the pain.
There's not that much treatment that you can get there.
Okay.
Yeah, but like usually doctors.
And
when
you're
go
coming from where? Where is mom coming from?
Moldova,
Moldova. And Moldova, for people who don't know, is near Romania.
Ukraine,
Ukraine.
yeah, Ukraine and Romania. Yes.
Ukraine and Romania.
Little country.
So you're speaking
Romanian.
Romanian.
Yes.
Okay, cool. All right. So let's fast forward then.
Okay.
She's been working most of her life.
Oh yes.
Yes.
Yeah.
Hard worker.
Yeah, me and my brother were on her shoulders, so.
Okay. Not a problem. So what got to a point where let's keep going into the story, because there's a big piece of this story we're not going to get. I know that.
Yeah.
Okay, and that's okay. Meaning a lot of time has lapsed in between and life happens.
Yeah.
So with life happening, we've had our slips, our falls. She has to work. She's dealing with it. But now we're at a point where obviously she's not able to deal with it. That's why she had to come over the pond. She had to come over the pond to see if there's something we can do to help her. Now let's go. You brought me some other images from 2014 and 2018.
Yes.
Correct?
Yes.
Okay. So why were those images taken? Why was 2014 taken? This happened in the 90s.
Okay, just a second. Oh, she wanted to see what's bothering her and if there is need for medical assistance.
Okay.
And that's why they couldn't. They needed these detailed shots.
But based on that, what you brought me, what did they say? What were you told?
That they are not. You're not ready yet for the surgery, and I mean, your back could be more damaged before you get the surgery. I mean, you still can walk, so go walk.
Got
Kind
it.
of
Okay.
like this, yeah.
Okay. Now you're bringing me an image of the neck, though.
Yeah.
Okay. So what's the number one complaint here?
Number one complaint
Yeah. What's her number one complaint?
was the worst.
Yeah.
thing.
What's number one?
Yeah, on her neck. I mean, number one is on her back right now.
Correct. Low back.
But it shifts. It shifts. The way she's telling me, it shifts. Now it's here. It was here, and then it was in the middle here. So I mean, it jumps.
So it goes between the low back, the mid back, and the neck,
Yes.
and it switches between all
Yes.
three. Okay.
Depends on
the day.
the
Right.
on the.
Depends on the day. Okay. And that's why she's here.
Yes.
Got it. Okay. And the last treatment she received was when?
2013. Massage?
Massage hospital.
Oh, she stayed in a hospital in 2013.
Okay.
And I don't know if you can call this treatment. There was no
Massage.
adjustment things. I mean, just massage things and
Whatever.
Yeah.
A treatment is something they did to her.
Yeah, 2013.
But now you brought me an image from 2018.
From 2018, she just done this because we were planning to come to visit you.
Got it. Okay.
And
You
yeah.
wanted to have a new image to bring
Yes,
to me.
yes.
Okay. So you found me and you suggested to your mother to come here and
Yes.
maybe there's something we can do for her.
Yes, I know you
And
can.
was she excited?
No. Like skeptic.
Yeah. Make sure you tell her everything I'm saying. I want her to know what I'm saying.
Eu am întrebat că eu am găsit pe YouTube și când s-a spus de dânsul ai fost fericit și am zis că nu ai fost skeptic.
So, but she's okay. She's here now. Did she watch any videos?
Yes, ne place video, da?
Yes. Okay. So you know that's what I do.
Yeah.
Okay. What else is going on? How is her sleep? Is she able to sleep with this pain?
Cu somnul. Dar poți dormi cu somnul ăsta. Spune cum merge cu somnul.
Am dureri când mă culc, totul mă doare tișet la piele. Când și aici când mă zbor, nu pot să le...
Okay, always in pain.
Always in pain.
And yeah,
constantly.
like little pillow only, and always in pain. Here, burning things, and
In the neck.
And when she wakes up, like it takes a little bit until she
Because it's
moves.
tight, it's stiff.
Yeah. Mm-hmm.
I got it. Okay. Anything else I need to know before we get started? Any medication you're taking?
Medicamente
No medication.
So she's a tough lady.
She
Tough.
doesn't trust medicine anymore. And people who tried to work on her back, they were helping her for a little bit, but because she was keep doing the way her lifestyle, I mean the work, like it was getting worse every year, and then she stopped believing in treatment things,
Okay.
and she was just trying to maintain herself to not get any more hurt from anybody else. That's why she was afraid to come here, because she was afraid if somebody else again is gonna touch her, how it's gonna go.
I got it. So she kind of lost faith in the system,
Oh yeah.
and she lost faith in doctors, and in any treatment for that matter.
Right, and she was trying to
She was trying to
support
fix it
herself,
herself.
yeah. I mean, just to deal with the pain and try to not get worse.
Yeah. And was there pain management? Did she have to take painkillers? Like what made it feel better?
La spital mă
No,
duc.
just in the hospital. Okay. No.
Eu până în 2013 stăteam des în spital.
Till 2013, she was often in the hospital, but not anymore.
Okay.
And she stopped working too.
Și atunci la sanatoriu și de-am lucrat.
So what's the goal here? Why are we here? What am I supposed to do? What are you expecting here? Why are you here?
I was hoping that you can align everything the way it's supposed to stay,
Okay.
and you're gonna tell us what type of lifestyle do we need in order to get her
keep her
regeneration.
healthy.
Yeah, to get her regenerating and
Okay.
Yep.
So first thing, I'm assuming that we need an answer of what is the problem. If I'm asking you, she's had this issue, and I say, "What's your problem?" If you brought me an image, a paper, that's fine. But if I ask you, what's the problem? Is it L5? Is it sacrum? Is it pelvis? Is it C5? Is it T6? Is it T7? What is it? What have you been told? What has been worked on? You see what I'm saying?
yeah, but or not using adjustment. I mean, like X-rays or things.
Okay,
They're
so
just
no one
like-
really told her her problem.
In a hospital,
Yeah,
it's simple. You're not ready for the surgery yet,
but you don't know what the problem is either.
but the problem.
Did they tell her what the
Ce
problem
problemă
is?
acolo, spune-mi? La
Herniate disc.
herniated discs.
Got it, okay. So that's what they said.
Grijă.
This was herniated disc
Yep.
diagnosis based on this.
And
MRI.
multiple herniated discs.
Sure.
5, 4,
4 or 5,
6.
T6.
5, 6,
5, 6, 7, 4.
4, 5,
5,
6, 7.
5, 5, 6, 7.
4, 5, 6, 7. herniated bladder? Herniated?
Well, it's a play on words, and we need to talk about that a little bit as
Okay.
well. So if we say there's a herniated disc, a swollen disc, a pinched nerve, they're all kind of the same thing.
Okay.
If we say stenosis, that's a different issue, different case, okay? If we use the term, chiropractors use the term subluxation, and I'm being very mindful of using this word because a lot of guys out there don't even like this word.
I don't even know what it is.
Exactly. And the subluxation has so many different meanings. In our profession, we're having a difficulty agreeing upon what a subluxation is. And Dr. Gonstead, in this method that we're doing, was very clear on the methodology of detecting and correcting these misalignments in the spine that cause the disc to swell,
Okay.
herniate, swollen, whatever you want to call it, that puts pressure on the nerve. Okay? But the general chiropractic term is called subluxation. And the problem that's happened is that we think that the subluxation is just a bone out of alignment and it's pinching a nerve. And that's part of the story, okay? And I want to explain this. It's very important that you and your mom understand this. I'm going to get the model, the spinal unit. This is called a functional spinal unit. You have the bone, the disc, the bone, the nerve. The disc has two parts. Explain to her this is the disc, this is the inner, this is the ball bearing, this is the nucleus.
Yeah.
Yeah, the gel, yeah. But this is non-compressible, which means it's hard material.
Okay.
This is soft material. This is hard, this is soft. This is a pivot. It's like a ball bearing. So it allows your vertebrae to move around.
Mm-hmm.
When it misaligns, it's not sitting on the ball bearing. So the trauma initiates the process, number one. Number two, the misalignment causes a process that's occurring at the disc. This is non-compressible, and what happens is it starts to go like this. It's going to push this soft material into that space. Okay, the swelling, the herniation, which can then pinch the nerve. Okay?
Yes.
But let's go a little deeper than that. So that's the general way that we look at it. What did Gonstead do with this? So his whole idea was find the bone that's out of alignment, that's causing swelling to the disc, that's putting pressure on the nerve. Find that one, correct it specifically in the right direction, and get the pressure off the nerve. So the swollen disc or the herniated disc is coming from the misalignment of the vertebrae on the nucleus. That's what's happening. That's the important thing. Your mom has a special case though from that trauma, and it's a little different in her case. We'll go over her x-ray. She has almost a spondy. It's called a spondylo, where if we look at the anatomy of the joint here, it misaligns back.
Yeah.
It doesn't misalign forward. But it misaligns forward if we have a severe trauma where there was damage to what we call the articular pillars.
Okay.
Okay, and it'll go forward a little bit.
So in her case is forward?
It's part of it is forward. So there's two parts of it. Okay, we're gonna go over all of it. I need her to understand that because then my job is very simple. I'm looking for the pressure on the nerve, right? Using the bone to realign and correct it. So we're pushing it forward. It wants to come back within a day or two because the ligaments have been like that for so long.
Yeah.
That's why we have the process we go through. You understand what I'm saying? I want her to understand it as well. Okay. So we're focusing on her dimple. She has a little scar there. What's that?
It was, how do you call it? This one. What is this?
A mole. She had it removed.
A big one, yeah, a big one.
Okay. You have a few of. She's had a few of those.
Good for today. In just that place?
Just that?
Just one. Yeah, it's just one.
Okay.
It's just big one.
Walk for me, please. Go ahead.
Mergi încolo, înapoi până ce n-asta nu stau.
Oh yeah. Keep going.
Mergi încolo, înapoi.
Turn around. You've watched some videos of mine, right? What do you see in the dimples? Watch here. they should move like this, right? She got the Moldova wiggle and the jiggle. Moldova jiggle. Watch the jiggle. Side to side. Keep going. One more time. Go. Keep going. Yeah, so we got that side to side jiggle going on there, right? We're not going through the joint as well as we could. And when that's the first part of it. Now let's look at her feet when she walks. As she's walking, we can see the left big toe. She's getting a slight bunion formation when we look at the toe. Keep going, please. And there's a power issue. She's having a tough time even getting those legs up. It looks like. She's in pain. But does she ask her in terms of her energy when she's walking. Does she lose power? Does she feel she has to rest?
Yeah, definitely.
Yes?
I know, without asking, I know.
And
especially when she came here, like, she's getting tired much faster.
Yeah. Now the right leg, watch, it points out, you keep walking. You see, I told you. The right leg points out and it swings. She swings that right leg. She doesn't plant the right leg. And then she swings on the back end of the back right heel. That's coming from her pelvis. Okay, it's a picture in time.
Yep.
Tells me how she is now. This is how she came to me.
Okay.
There's 24 bones in the spine that move. 7 in the neck, cervicals, 12 in the mid-back, thoracics, 5 in the low back, lumbars. And then we have the foundation of the building, which is the sacrum and the pelvis. Okay? This is the side profile, looking at her. Side profile, we are designed to have 60-degree reciprocating curves. Should go 60 forward, 60 back, 60 forward. Here you can see she actually has a reverse curve going on in her neck. It's going the wrong way. It's going the opposite way. So we need to figure out where it's coming from. There's an MRI. And this MRI says you have a C5, C6 herniated disc. That's what this MRI says. Okay? That's what this MRI says. And I'll explain that in a second. Now this one is your thoracic spine. And this one says T12, T7, T1, that you have slight protrusions, correct? That's what you were told. Okay. Now, here's the issue that we're having with these images, and maybe they're right, maybe they're not. I don't know yet until I examine you. But I do want to explain something on this image. So I'm going to put up your profile here. And you were told this was back in 2014, yeah?
This is the picture.
Yeah. So I want you to look at a couple of things. This was you lying down. She was lying down. Yeah,
Yes.
yeah, she was lying down. The spine is weight bearing. It should be imaged weight bearing. We're seated. Now, if you look at her curve here, she has a reverse curve here. Here she doesn't have a reverse curve, does she?
Because she was lying. Right?
Because she was lying down. Now, I want to explain a concept there's a concept of intersegmental motion versus global motion. Intersegmental motion means each vertebrae moves a certain amount. And the authors of the textbook, Clinical Biomechanics of the Spine, the authors are White and Punjabi. They have already quantified that each vertebrae will move a certain amount in the cervical, thoracic, and lumbar. Okay? Hold that thought. If I say, turn around, and I tell her, touch your toes. Go down and touch your toes. Just touch. Just go down the best you can, as much as you can. Okay, good. She can still do it. Now, the reason she can do it is there's one segment that's stuck, or a couple of segments. Turn around. Now, one segment gets stuck, 2, 3, 4 segments become hypermobile. When you put someone on their back, the stuck segment usually doesn't move. The hypermobile segment moves more. And it can appear to be a swollen or herniated disc. And it can appear to be that it's in a place that it's not really there.
So
Just follow my thought process. Because when I look at you brought me this image that says C5, C6. Your C5 is fine. Your C6 is wearing out. But the fact that those are in the apex of this reverse curve tells me that's not where it's coming from. But here, they were clear they were going to do surgery there. Now you can take your images, sir. Thank you.
you're welcome.
We can keep them over there on the table. So, now let's go over this image. Let's go over the foundation first. This is the foundation of her building. She has a little bit of rotation in her tailbone. The main thing is, though, her pelvis is turned to the right side. This dot goes 9 millimeters out. So she's got rotation to the right. It takes the spine with it, and then the body has to compensate. It's causing this curve. It's trying to bring the body back to neutral. So let's go over this. 5 goes off, 4 comes back. 3 goes off, 2 goes with it, 1 goes with it, 12, 11 back to neutral. 10 goes off, 9 goes with it, 8, 7, 6, 5, 4, 3, all the way to 2. All of this is compensatory. And the next one to go off is 1. Her neck is coming from her T1, coming from down low. Now, these are the potentials we're finding on the x-ray. We have to examine her to find the problem. Is that okay? So, the first potential is L5. Second potential is L3 negative, T10, and T1. Okay? These are the potentials. It means it's going to be all or one of those.
Yeah.
We have a rotated sacrum and we have a rotated pelvis. Now, when we look at this bone, it goes up on the left and it turns to the right side. So we're labeling, this is an IN9 ilium. So she has, her major issue is a rotated ilium on this x-ray. It's causing all of this to go off. Number 1. Now let's go to this x-ray. Because this x-ray, if we're looking here, again, stop me if I'm going too fast, okay? But you follow me, right?
Yes.
Okay. So we have some curves here. This is not scoliosis. Some people may have told her that, okay, if she took an x-ray. Nobody told you scoliosis. Okay, good. But some people may think that's scoliosis, okay, if you brought this image. The thing is that the foundation is off, this has gone off, and the body's going through this compensatory mechanism, okay? This is also controlled by some of this surgery that happened.
Yeah.
Part of the nerve comes from there that controls that. So I'm just pointing it out now. I'm not in the business of straightening spines here. That's not what I do.
Okay.
Okay? My business is to find nerve pressure and to help reestablish these curves here.
Okay.
And this is why it's so important. You can see she carries most of her body behind her foundation. There's instability. Okay? Breathe. Breathe. You're here. You wanted to know this, right? Okay. Now, here's what I want you to see. From L5, look. This is L5. So C2 should be here. But here's the interesting thing I want you to notice. The whole upper back sits behind the foundation. Okay? But here's what I want you to see. Look at L4. L4 is all the way in front of the center of L5. This was that injury that you had, okay? And this injury caused what's called a pars defect. It broke here, and it slipped forward.
So it's a broken bone?
It's called a spondylolisthesis. You have it's a spondylo at L4. However, if we go deeper, she also had those tailbone injuries on her butt. So we have the sacrum. We have to figure out the sacrum. 4-5-S1 and the right pelvis in terms of the low back. If we don't stabilize the foundation, doesn't matter what else I do for you, right? Make sense?
Yeah.
And in terms of the neck, we have to figure out what's going on here. The x-ray is saying that, but again, we find it on you, not the x-ray.
Okay.
I'm just telling you what we see here.
Yeah.
Okay? All right? Have a seat. Let's get started. And we're going to start scoping the base of the neck. And the first thing we're getting is T1.
Mm.
15 points at T1. Now it looks like it's going to break on the right side there. Watch the scope. But it's going to come right back and break there. So there is action here, but it's not the cause.
It hurts her there.
I know, I get it. Around T9, T10, I'm getting pressure at the left side. That's around T9, T10. Now, as I get over here, all of this is going to be foundation, by the way. All right, so as we get down, this is all starting down in her S3. Down low. S3, T9, T10, T1. Those are the three majors. Let's check her pelvis, please. Scoot forward. Open and close. Right side only. Right side. Right. Open. Close. Open. Close. Okay, when she does that, the left is fine. Do the left side. Right's fine too. I don't see the pelvis as the major at the moment. Okay? Scoot back for me, please. Let's try this one more time, a different way. Let me do the work. Top of the joint. Pain? Not really. Pain? More pain top? More pain bottom? Bottom? Or top? Bottom. So we're feeling more of the swelling and irritation along the border on the bottom. Yes, and I'm not going to go harder than that. There. Now let's go to, now here's what I want her to see, okay? This is, sit up straight. Yep. And we're going to go back into extension slowly. Good. Now, this is sacrum S1. This is L5. This is L4. So it dips in there. Pain?
No.
Right there. There. She's got a very high pain threshold. She's been through a lot. You don't have to tell me. It's okay. Right there. Yes? Yeah. This is starting down in S3. Yeah, she likes to laugh. S3. She likes to laugh her pain away, right? Right, madam? Ask her what I said. Head down. That's her defense mechanism. Static palpation as we're going down, right about there. You can see the swelling. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pain? 9. More pain up, more pain down.
It's giving her pain like across this.
So when I push here, it's going across, or when I push here?
Când apeși acolo sau acolo? Când jos sau jos? When down, when you push down.
10. So doing T10 is causing radiating pain around her left side. How about the right side? Stand over here so you can watch and we can talk. T10 radiates pain around the right here. This one or this one?
Care
This one.
Mine's a little.
She said that she's confused now which one it hurts more.
They both hurt.
Yeah. Amândouă doar. Amândouă te doar.
Parcă mai sus mă doar.
She said that it looks like upper, it's hurting her, and it's giving her pain in
Radiating
ribs.
pain to the
Yeah,
rib.
yeah.
Okay, let's try that one more time.
Sincer.
1, 2, 3, 4, 5, 6, 7, 8, 9, or 10.
Nu, să zici.
This one
Yeah.
or this one?
Sau
Oh,
celălalt.
yeah. Sus.
Upper one. So this is 9.
Care de sus sau de jos? Sus, da.
Sus.
Okay.
Așa jos.
Now she's feeling it at 9. Count just to make sure. Head down. Head down, please. Look down.
Jos.
Make sure I'm counting right. I think I'm off one. Her VP is 7. I was counting it as 1. 1, 2, 3, 4, 5, 6, 7, 8, 9. Right there.
Te dai? Te dai?
Okay. So here's what's happening. It's shifting. Each time it's happening, it's shifting. So what does that tell us? She feels the pain at 9 and 10. We're going to start on the sacrum and we're going to start on the base of the neck.
Okay.
I'm going to have her walk a little bit and then I'm going to recheck this middle to see what it is. Because when it starts to shift around too much, okay, then you got to figure out why is it doing that. Sit back for me, please. Let's check the neck.
Ați verificat.
Okay, this is 6. The good part is there's still good movement in her neck. There's a good chance this is all going to come back.
She exercise every day.
Good, 6, 7, T1, right there. This is where her neck is coming from, right there. T1, sacrum, and then we'll recheck everything.
Okay.
Walk it off once and we'll get started.
Mergi încolo încoace. Mergi încolo încoace.
So we're going to set T1 as a PRS, and we're going to set the sacrum S2. Actually, we're going to set S3, not S2, sorry. All right, have a seat over here.
6.
You ready, Mama?
Ești gata?
Ești gata?
Da.
Yep.
Ești gata?
Yes.
Yes? Ești gata?
Ești gata.
Ești gata. I'm learning so many languages with people coming from there. Ești gata?
It's amazing to be able to tell so many people, right?
It is. It's a blessing. Madam, you're going to put your hands right here. And we're going to set T1 right there. Nice and easy.
Stay relaxed, right?
Nice and
Stay
easy.
relaxed.
She is fine. Right ear down. Good. That's good. Right there. Ooh, she's going to fight me a little bit. T1. Right ear down.
Oh.
Home run. She's smiling at least. This is good. Stand up. Stand up. Let's stand over here on the black platform. You want to help? Come over here. You're going to hold her ankles.
Alright.
Slide up first. Tell Mama go all the way up here.
Dă-te în sus, așa, cu fața asta aici.
Alrighty. Good stuff. Now we're going to save the mid-back for later. I'm going to recheck her after this adjustment.
Okay. Whatever, just
This is gonna be fun, alright?
I
This is gonna be fun. We're gonna set sacrum. Alright,
How
let's
do I
do.
help?
You're gonna lightly hold her ankles like this.
Okay.
Light. You're gonna catch, don't push. Okay? And Mama, it's time. Ah. Let's cover. Okay. Deep breath in.
Răsuflă înăuntru.
And breathe. Good. Exhale.
Răsuflă în sus,
Come on,
în jos.
just normal breath. She's tense. Come on. Here, put your hand up there.
Ieși răsuflă normal, mai.
Good. 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 Now, it's slightly rotated on that left side. But I'm not so much concerned about the left rotation because it's acting more like a spondy. So I'm going to be torquing it counterclockwise. Home run. Gotcha. Gotcha. That's it. That's it. I got you, lady. I know. Let her go. Ah. Tell her that was a good yell. And I'm going to explain something to you.
Okay.
She had some emotional trauma with that trauma. We know that.
Yeah.
It has to come out. So
Yeah.
don't be surprised if she cries.
Yeah.
If it's not today, it's going to happen.
Yeah.
Hold my hand.
Ține
Hold my
mâna. Ține
Hold
mâna.
my hand. You see what I'm saying?
And
I need her to cry. It's
Dacă
okay.
vrei să plângi, it's ok.
Just go like this. It's okay.
Ridic mâna să
I know. No. Walk. 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 Don't stop. Walk.
Mergi în
Walk.
continuare.
Walk. Let her walk. You keep walking. I told you it's going to happen. Let it happen. A little bit is the pain, but it's more.
Yeah.
Okay? It's okay. You're going to be okay. Keep walking.
Continui să mergi.
You'll be there. Keep walking. Turn around, I wanna.
O să te întorci. Cum să?
Keep walking.
Avem dureri mari, dar nu așa să împrești.
What's going on?
I asked her how she feel, and she said it was hurting her a lot, but now it's relieving.
Keep going.
Mergem.
You can already see the dimples are changing in the butt. You do see that, right?
Not
yet?
I mean, I'm not that
Look here.
Yes.
When we started, she was going like this,
Yes,
side to
yes.
side. Watch now. Walk.
Mergi mai.
It's less now. So, what is she feeling as she's walking each time? So I want her to speak it out loud in her language,
Ok.
not soft.
Ce simți când mergi încolo încoace?
E că de durerile așa strec și așa dureri.
Oh, she feels nothing. Oh my gosh, I'm speaking like her pain is going away and some pain over here.
You slow. Keep going. Okay, come back over here, have a seat. Let's continue. Now, just even watching her sit is different. Good job. 0. 0, dude. Clear. All right. Guess what? Mid back is clear too, dog. Nice. We did a good thing by not touching her mid back today. Look, dude, come on my side over here. You can see it. You see it, right? It go bye-bye. It went back to Romania.
Yeah, hopefully.
Scoot forward, please. Go forward.
Miște înainte.
Uh-huh. Now, I want her to feel sit up straight.
Stay there.
Now watch. Back slowly.
Just short and cross.
Good. She needs to be walking now. So that's T1 and S3. I'm going to work on her shoulders now. I'm going to do her right shoulder. Over, down, plus. Over, around, down. Go on your back. Ankle, talus. Come up slowly.
Since it's short.
Let her get up by herself. Have her walk again, please.
What's the next from what's that? Hurts.
No problem. I'm going to get to it. What I'm going to do is break up the scar tissue. Now she gets the buff and polish. Okay, walk again. Walk again.
Yeah, we like that. It's good.
Little better?
Este чуть-чуть.
Maybe not that.
Она когда не создали ренквача, есть
Her pain went into that part over there.
How's the neck?
Cum gâtul.
Это самое шурьё,
It's easier, but still she doesn't understand.
Let's go down.
Yeah.
Last thing we need to do. I'm going to actually work on that right pelvis, but I'm going to use the drop, which is going to absorb most of the shock. I just want to get it started, okay?
Okay.
I'm not trying to go too hard with it. You don't have to hold anything.
Okay.
I'm just going to work on this IN ilium. Bracing the left, doing an IN ilium on the right. That's it. Okay. Hold my hand. And let's walk again. Then all she has to do now is ice.
Ice?
Ice, yes. You're going to put lots of ice. And I'm going to see you in a couple of days, okay? Welcome to the office.
Yeah. Thank you.
You're welcome.